Dental sealants represent one of the greatest advances in modern dentistry. Sealants are widely used today because they are highly effective in the prevention of dental caries in the pit and fissure areas of the teeth. They are clear protective coatings that are easily applied and cover a small portion of the tooth surface, therefore preventing bacteria and food particles from setting into the grooves and fissures of the teeth.
Indications for sealants include when the client is in a caries active period, usually around ages 6 to 15 years, recently erupted teeth, incipient caries, if they have deep pit and fissures, they have xerostomia, they are currently undergoing orthodontics, they are receiving head and neck radiation therapy, they have infrequent professional preventive care, and they have a high caries experience.
Contraindications for sealants include evidence of proximal dental caries, pit and fissures are well coalesced in self-cleansing, restorations are present, insufficiently erupted teeth, primary teeth are expected to be lost soon, or poor patient cooperation.
Advantages of pit and fissure sealants include they are cost efficient, the sealant is able to act as a physical barrier that prevents dental decay, relatively little time is required for the placement of the sealant, and anesthetic is not required.
Disadvantages of pit and fissure sealants include not always being permanent, little fragments can break off throughout the years, and if incipient decay progresses, it can get underneath the sealants and become an active cavity. There are two treatment options for sealants. There is self-cured and there is light-cured. If there is decay that is too severe, a sealant should not be placed, and therefore a composite resin would be the treatment option. Factors affecting the success of the treatment include saliva contamination, voids or bubbles in the pit and fissure sealant, not the recommended time according to the manufacturer's instructions for the acid etch, or a high occlusion.
Hi, Mrs. Hudson. Hi, my name is Patricia. I'm one of the treatment coordinators here at Durham Dental.
Oh, okay, nice to meet you.
Nice to meet you too. So Bobby's just finishing up in the other room with Patty Ann, the hygienist, with his cleaning. So Dr. Montola said he wanted to place some pit and fissure sealants on Bobby. So I guess you just had some questions about this. You weren't sure.
Yeah,
what they were?
I've never had a pit and fissure sealant before. I'm not quite sure what it is.
Okay, so basically Bobby just has really deep grooves in his teeth, so when he's brushing, it's really hard to get all the way into those grooves and clean them.
Okay.
So what we want to do is we want to place, we have numerous colors, so we have clear, white, or opaque plastic filling material we would put in those grooves and just seal it off, so it prevents him from getting cavities, because if it's not getting reached with a toothbrush, it might be more prone to that happening.
Okay. How long does this procedure take?
Usually it's not more than 5 minutes per tooth. It's a pretty quick procedure.
Okay, because Bobby gets quite antsy, so we don't want to be too long.
Yeah, no, it's not a very lengthy procedure. It sounds like a lot of steps are involved to it, but it's really quick once you're going.
Could you just tell me what the procedure kind of consists of?
Yeah, so first off what we do is we clean the tooth. We use this material called pumice, and we just want to use that to get all the plaque and debris off the tooth because we don't want to seal it when there's bacteria and stuff underneath, right?
Okay.
So we just clean out the tooth first. So after we clean off the tooth, we're going to isolate it just because we don't, if there's saliva and stuff, it's going to affect the success of the sealant. So we just isolate it and put cotton rolls around it to make sure the saliva stays away. And then we're going to dry the tooth. After we dry the tooth, we're going to use a material called acid etch. So what that is we put that on and we leave it on for 30 seconds about. And what it does is it creates tags in the tooth structure. It's in the enamel, we call, just so it's better adherence of the sealant material, so it'll stay longer. So after we put on the acid etch, we let that sit for a couple seconds, like I said. We rinse that off. We dry that off, we re-isolate it because now it's all wet, and then we place the filling material in, and then we move it around to just make sure it has complete coverage of each tooth. We cure it or harden it with, we have this thing called a curing light.
Oh, I've seen one of those before. Yeah,
so it just hardens the material and makes sure it's on there tight.
So how long is this going to last for Bobby?
Sealants can last anywhere from 5 to 10 years. It really depends on certain factors that can affect the success of the treatment. Like I said, like if there's saliva, that'll affect the treatment. How long the acid etch stays on, because that is going to create better retention.
Okay.
So it really depends. But if there's a well-placed sealant, it can last anywhere from 5 to 10 years. It's
Good. Okay, so that means that he won't get any cavities. He won't need any.
No, it seals off the area, so bacteria can't get down and in there and penetrate those grooves.
Okay, perfect. Can you tell me how much this is going to cost? Is this going to be too much?
No,
or
it's actually
affordable?
very affordable. Sealants can be around $20. It really depends on what tooth is being worked on.
Okay.
But in the long run, it's going to benefit you because they're a lot more cost effective than it would cost to place a composite resin filling.
Oh, a filling would be more expensive?
Yeah, a filling, because there's more tooth structure lost and it's a more complicated procedure. A lot of
Okay.
times they need local anesthetic.
Is this procedure going to hurt Bobby?
No, there's no local anesthetic used. It's all done right. The dental hygienist does it. He doesn't need to go see the dentist for this.
Oh,
this,
okay,
yeah.
perfect.
Yeah.
Well, I like the sounds of this treatment.
Yeah, so I think that would be his best option to go with that.
Well, I'm good with that if you'd like to proceed with that.
Awesome. So we can set up an appointment
Yeah,
tomorrow
for
and come back
sure.
and do that.
Thank you so much.
Sealants are widely used today because they are highly effective. In the prevention of dental caries, that is still the same sentence. The prevention of dental caries in the Pitt and Fisher, sealants represent one of the greatest advances.
He's having a prevents dental decay. They're relatively little. Okay, start again. First, they're cost efficient. No, I don't like that. I like saying first. Sealants include. They're cost efficient. Barrier. I'm trying to think what I want to say. Am I going?
Yes.
Oh, oops. My bad.
Just keep
I-
What?
Okay. Start again. Go. How do you think about Sorry, I didn't realize you were starting.
Now I know that you want to know a little bit more about dental sealants because Bobby.
Because Bobby needs them. Yes. Okay.
Take 5. What kind of material is that? Did you say?
I can't say that again.
Oh no, I was just looking for plastic.
Oh, I don't know how to say that one line. Hi, my name's Patricia. I'm one of the treatment. Oh my God! Seriously, Brittany, I'm not even in the room yet. Finishing up in the other room, and I'm already shaking your hand. So what we want to do? What are you doing? I'm doing so good.
I'm so sorry. Yeah, that's the last time I'm gonna laugh. I promise. Sorry.
Wait, I'm like sweating buckets here.
trying.
Oh my
I'm
word.
trying. I'm sweating.
What?
I swear to God, last take.
Last take.
Last
My
take.
introduction. I'm not even at the hard part yet.
Hello?
That was so good. Is my face like really red? It is pretty red, eh? And cut.